And joining us now to discuss this latest development is medical virologist and lecturer at Adeleke University, Osun State, Dr. Kolawole Oladipo. He joins me via Skype from Osun State. Good to have you join us, Dr. Oladipo. These are really not new guidelines. These are just reinstituted guidelines. They've been there. It's just that people were not adhering to them and states were not following up as well. So how optimistic are you at this time that we will see some level of adherence to these guidelines?
Yeah, I'm very sure that this time around, based on what is happening in India, Brazil, and Turkey, and all of us being acquainted with the news, we're going to take our necessary precautions, and they've saddled the security agencies such responsibilities of challenging people. And I think state government also have been saddled responsibilities of taking care of all those necessary things in the society by adhering to non-pharmaceutical measures in controlling the virus. And actually, it has been said, our health system does not have the capacity to manage such a case in Nigeria for now.
And there is even no, it's been proven that there is no health system around the world, when we look at what's happening, that has the capacity to handle this kind of cases, not even in the United States. We've seen what's going on there as well. But you mentioned the state government. This does place a lot of responsibility. When you look at the guidelines, it places a level of responsibility on state governments to enforce. But when you go to some states, people are not wearing masks, people are not, there is no temperature check in some places. Do you think that we're going to see any level of responsibility by state government in terms of enforcement?
Yeah, I think state governments are able to the task, and they should be able to do that because they have to safeguard the health of their citizens in their state. Because without that, it's going to affect their economic development or growth of such a state. And looking at what is happening now, normally as a human being, we do relax, expressing the first phase and second phase. That's why the relaxation is coming in. But we don't use our own case to learn. So from this now, the state government will rise up to the task and make sure that they enforce all these rules and to make sure that everybody are complying to all the non-pharmaceutical measures, which is even the best method we can use in this scenario.
So for those who are wondering right now, that look, we seem to be on the right track when you look at the number of cases that have been reported recently, and we also seem to have started vaccination, albeit still at a very low level. They're wondering what's going on. Why are we having this reinstituted guidelines all over again when it looks like we're doing well?
Yeah, you're going to know that look at the population that have been vaccinated and the population that have not been vaccinated, you discover that like 4 million plus that you're talking about compared to 200 million plus. So we still have a larger part of the population to be vaccinated. So, and the best method to use to protect the populace is by sticking strictly to the non-pharmaceutical measures. And I'll tell you that being vaccinated again doesn't mean that you cannot be infected. It's only reduced the severity of the disease. And look at what we are testing now. There are cases of asymptomatic individual. Mostly people who are tested are symptomatic individual. And like if you look at the guideline, people that are 60 years old are being advised to stay away from crowd, and those who have comorbidities. And it's so funny in Nigeria, majority of our population do not know that they have such an ailment because people don't go for regular checkup in the hospital. It's until when they come down with a disease that another one will be detected. So because of that, we have to stick properly to that non-pharmaceutical measure, considering the number of population that has been vaccinated.
Thank you so much for talking to us, Dr. Kolawole Oladipo, medical virologist and lecturer at Adeleke University, Osun State. Thanks for talking to us.
Thank you.